you're running a massive, basically, a healing response. There are a lot of times they're really elevated in these patients, but they're not mounting a killing response. They'll have a high amount of IgG, EBV, a high amount of IgG, HSV1, high amount of sometimes CMV cytomegalovirus also. And it becomes a problem where the individuals become exhausted, neurologically impaired, breathing issues. And this is a constant now, especially post-COVID, because that was another virus, another tackle on the immune system, that you're seeing a tremendous, amount of. So I take it back to, where does the doctor start? The doctor starts and the individual start, which I don't see enough of starting off with the basics. If you're jumping straight into peptides without understanding the individuals, the things that they have control over, the diet. If you're not going over the diet with them and making sure that the gut can even absorb supplements, you're taking the wrong approach of throwing peptides into them. You're taking the wrong approach of throwing cells, exosomes, whatever you decide to do at them, because you're basically starting off with a really dirty lawn. And you got to mow that lawn and get rid of that tree to have an open slate to start off with the right way, because otherwise you're setting yourself up for failure, and you're also setting up the patient for failure. And if you don't get a deep understanding of these type of things, you have patients that actually get injured, because I've seen this in the stem cell sector, that people are getting injured. They might have an overactive immune response. They might have other types of response. They might have some kind of bacterial virus that has going on. And then all of a sudden you throw in a cell, and a cell that you might think is going to regulate the system actually causes a viral overload, because you're not mounting the correct response to kill it. And you're putting something in there that's causing more harm because it's just trying to regulate, but that's not what you're really after. You're after a correct balance of, let me eliminate some of the burden, let me clean it out, then I can put the regulator in.
Absolutely.
And it's what's happening a lot now.
And it's one of the things that we teach constantly is, like, go back to basics and think, okay, step one, like if a patient is presenting and they are symptomatic, right? Whether it's acute or chronic, there is something going on in their system. Then we're first going, okay, let's assess what, if anything, could be overloading the system. So what, if anything, do we need to reduce and remove before we think about replacing and replenishing? I used to use the example all the time. It's like, if there's so much, if we all hear of inflammation as fire, like, that, okay, great. So if things are on fire and I'm going to or I used to say, to make it easier, think of it as a crowded room. It's very noisy. Like, it's just so noisy. And I can go drop something really great in there. But if I put this one thing in that's super awesome in this really noisy, overcrowded space, it's going to be like, Horton hears a who? What? I can't hear that little voice. So it's like, no. Like, let's create some space so that what we do drop in can actually be heard, can be recognized, can be read, it can be responded to. So to your point, so let's talk a little bit of best practices for a few minutes. And I mean, I want to spend so much time with you, but so just a reminder to all of our clinicians, if you are not, for any reason, looking at the gut, you're not doing any type of, cleansing protocols, and we'll use that in the context of food and what are they taking in? And we always look to food, because 3 times a day for most people, right? They're doing that action. They are taking something in. And so that's an input. What's the quality of the input? How's that potentially affecting that system to either have a positive outcome or negative? So have you seen clinically, before I kind of move through a few of these steps, do you have an opinion on, or does the research show from your view, a most appropriate kind of nutritional approach to take with the clients at first?
That's a difficult one. I'm not the ones I can tell you that they all work well, and everybody's different. So they're all different. They all work well. The one I do know that is not the right way to go for women as they get older is, unfortunately, vegetarian. I've seen a lot of bone marrow. We'll pull bone marrow, and the plasma in that bone marrow is not nutrient rich. Cells won't grow. It ages them. That's why you lose muscle mass. You age prematurely. You look at everything from that aspect of it. It's not the correct approach. Those are the only ones that I see, although being a vegetarian in men in some instances, especially when a little bit younger, can help. I'm more on the Dr. Dan Pompa's flex aspect of it.
Yeah.
And but it's got to be clean. There's nothing more important than it's clean. You know, it's funny you said on the average people are taking, I don't know, people are consuming 10 times a day.
Yeah.
Majority of people are like eating something like 7 to 10 times a day. It's like a ridiculous number.